All right. Welcome, 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 ladies and gentlemen. Welcome to Real Talk for You, Dr. B, stress free. I'm really excited, you all, because we're just growing and glowing and getting professionals to join us. And the purpose of this podcast is to just bring people on. We can share and care, and we're dealing with having professionals here that you can communicate with and
Yes.
understand what it is that's going on from a health perspective, from a wealth perspective. If you have an interest in writing your own book or writing your story, we can help you with that. We're also going to be talking about politics, and that's my word for politics. But, just looking at bringing people together because since the pandemic, people have been so stressed out. And when I think about what's going on in the world today, my children tell me I watch too much news, but when I hear words come out of people's mouths, then I just believe what they have to say. There's an old saying, you know, hey, if they say something, you got to believe it. You have to believe people are who they are and who they say they are, right? And so when I think in terms of what's going on, I just participated in a minority procurement conference down in Detroit, Michigan today, and there was a medical professional that was online, not online, on stage. And, she talked about some things. And, I think everybody is looking at mental health right now because mental health is key. There's going to be some ripple effects from COVID that has hit us. And it's just okay to be not okay. And that is what's so important right now in our world today, in our society, because we're seeing people that just don't have patience anymore. And, people that are self-medicating and they're just doing other things to make themselves feel better. But in actuality, what they're really doing is they're just covering up some deep-seated issues and problems. So, with that in mind, I have the pleasure of introducing to you all today a young lady that is definitely a mental health professional. Um, she's an international speaker. She's a trainer and a coach. She is the CEO founder of Enlighten Heart Services LLC, and they provide and facilitate mentoring, inspiration, and strategic partnership to basically, when you start thinking about what people want to do to help them have more leadership capabilities and fulfillment. And she does a lot of professional services. She's written a book called Mommy. And what is that? Let me put my glasses on.
Yeah, mommy, I need you.
Mommy, I need you.
Hmm.
And so that's what this thing is all about, is bringing to you live people that are professionals that can help you and help us help you as well. So without further ado, Regina Hall.
Yay, yay. Well, thank you so much, Dr. B, for having me here today. I really appreciate you inviting me on your podcast and looking forward to interacting and answering any questions and sharing my story and hearing, what others have to say because I love the fact that this is collaborative and it gives us an opportunity to really talk and engage one another. So thank you so much again for the invitation.
Well, thank you for being here.
Yeah,
So let's start off by just tell us a little bit about yourself, your background, and all that.
sure. So what I like to say is first that I am a child of God. I'm a Christian and I'm also a pastoral counselor as well as a licensed professional counselor. And I just love the Lord. I feel like Jeremiah is just shut up in my bones. And when you talk about sharing a little bit about myself, when I think about me and my characteristics about who I am, what I can say that I am resilient, I am driven, I love God's people, and I enjoy helping others. And what my business is all about, Enlighten Heart Services, we work with professional women who want to increase their leadership capabilities and find fulfillment in their professional lives. And in a nutshell, it really means that I help women to deal with the issues of life. I am also a trained John Maxwell. certified speaker, trainer, and coach. I have had the pleasure of speaking internationally, as well as I have been trained by Les Brown, a motivational speaker. Really grateful for the training, and during the pandemic, I was able to receive that training from Dr. Les Brown. And I believe you asked me yesterday, how's he doing? 75 years old, still moving, still shaking, still advising.
Wow.
It's a beautiful thing, to see that. I'm also a recent grandmother.
Oh,
Yes,
congratulations.
yes, 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 yes. She is about to turn 7 months on the 2nd
Wow.
of May. Looking forward, to that. Already standing up on her own. She pulls herself up, and my daughter's like, she's not supposed to be doing any of this. And I keep saying, just, hey, you got to accept her where she is,
That's
because the
right.
girl is on the move, okay? She's not wasting any time. One daughter, I'm married, and we've been married now for I want to say 17 years. I think we just celebrated 17 years. Listen to me. I was
Beautiful.
like, was it 16 or 17? But 17 years. And grateful for our marriage and what God is doing in it. And just really, like I said, loving God's people. I'm also most of what I do, I talk about distortion. Okay. So I do want to
Hmm.
just bring it there. And when I
Okay.
talk about distortion, cognitive distortions, I do it from the cognitive behavioral therapy. That allows me to transcend not only into mental health, but also in speaking and in my training. It allows me to engage people and get a better understanding of who they are and where they are, but we first have to start with distortions. That's what I do. So, in
Hmm.
starting with distortive type of thinking, what we want to do is really begin to break down those thoughts that keep us bound, or those thoughts that keep us stuck. When you think about cognitive behavioral therapy, and you deal with it from the truth shall set me free, then you got to deal with those things that are keeping you bound and keeping you stuck. And the way we deal with that, as I stated, was cognitive distortions. And so, what are cognitive distortions? Well, I'm glad you asked. Cognitive distortions is us believing in things that are not true. So we believe
Wow.
them, but they are not true. And everybody does it. So if anybody's saying, well, I don't really have that issue, I'm a realist, I know what I believe and I feel firmly about it. No, got news for you. Everybody believed in a lie sometime, somewhere, someplace. Yes, we have all believed in lies. And really, from a Christian perspective, we believe in the prince of the air. So he is the father of lies. And so there's just lies all around. Matter of fact, you
Mm.
said we were going to talk about politics. When you even think
Yes.
about that, all the lies and
Oh,
that are being told just to even win a race, or what's being told out here as truth to manipulate the minds of others to get them to believe that this is true, and people are believing it. So let me just be truthful about that. I hear it too often. People are believing lies, and
yes, they
unfortunately,
are. Can
yes.
I ask
And
you something?
oh, go
Can I ask
ahead.
you something? Okay, because this is a fantastic topic, especially for what's going on in today's society. Now,
Oh,
you're saying we're all guilty of it, so I will
we
accept that.
are. Yes.
But do you believe that some people are a little more caught up in it than others? And I guess is that where you kind of cross the line from mental, maybe some type of mental issue? Or is it, we all want to believe, even in relationships, there might be something going on in a relationship, and we know is we kind of believe is going on, but we don't want to believe is going on. So we kind of shift our thinking to make it distorted, right? I mean, it's distorted because it's kind of like, but in some situations, people really, really, truly believe whatever it is that's going on. And then other situations, like with our politics, you have people that are coming on TV and or people picking up on sound bites, and those sound bites sound like it's believable, and people run with that. So they truly believe it, but they really have not done their research to really understand what it is that they just heard or saw.
Hmm. So what's your question, Dr. B?
So I guess my question is, there's some people from a mental perspective that just might have issues, like people that might have schizophrenia or something like that, where their mind is playing tricks on them and they're believing what they're telling you. They really believe it, but in actuality, it's not reality. So that's one group. The other would be just people that are strategically playing with our minds and only telling us part truths. And so we go along with that as well.
Well, I think you make some very good points, right? We don't research enough. We live in a social media age where we believe whatever's being told on social media. We
Mm-hmm.
do need to do our research. There are lies that are being repeatedly told, and it takes us to do the research. Oftentimes, when you think about politics,
Mm-hmm.
um, they're going to really hit you where you are vulnerable and where they believe that they have the answer to help you in this situation. So let's look at vulnerability for a minute, right? You have a lot of people, and I think the border situation can touch anybody. So let me just say that. But you will hear people saying, well, criminals are coming over and they're going to do this and that. And when you really get down into the research of it, you hear about it. There is more crime happening here. Now, it's just not
Exactly.
to say that some of the people, immigrants that come over, are not committing crimes. Because crime happens everywhere. And so I think that when we think about immigrants, let's just get down to it that we all are immigrants. Even people who think they're not immigrants, they're immigrants. Everybody, most of live here, came from some other place except the native Indians. Let's just deal with it from there.
That's true. That's
That's
true.
just true, right?
Yeah, let's get
So
real with it.
everybody here in America is an immigrant.
Exactly.
Exactly. However, we have bought into this thing about immigrants. Let's just deal with the Great Migration. A lot of
Mm-hmm.
people migrated to the north. They came from the south to the north to get jobs, to get better jobs and stuff like that. It is people that believe that you're coming to take their job. Well, the truth of the matter is if there are jobs available, that it can really, if you're getting a diverse group of working these jobs, you really are upping your ability and your population to be more productive.
Right.
And so there are so many lies that are out there that people are buying into. And I remember Dr. Sampson, bless his heart, he's gone on to be with the Lord.
Reverend
And
Sampson. Yeah.
Dr. Sampson would say that we don't critically think. We do not live in a society anymore with people think through a thought. You got to think
Mhm.
through it. You got to reflect. You got to take time out, do some research. And if you don't want to do the research, begin to explore it with people who are not of the same mind that you are. Maybe they've studied in some other areas, but you're talking to your friends. Like, yes, the other day I went to the post office, and people call it inflation. We are not in inflation. I just want to pause you for a minute for that one. We're not. They're gouging. That's what they're doing.
That's
They're
right.
upping the prices. I went today to Costco. I kid you not. I used to get this huge bones for my dog. Okay. Huge big old box for like $10. I couldn't
Yes.
believe it was that cheap. So let me just tell you that.
Right.
Now it's half that size now. They have half the size, and it's $16.99 now.
Shrinkflation.
That's what it is. It's shrink. Yes, shrinkflation. I love that. That's
Shrink.
exactly what it is.
Shrinkflation. I know
That's exactly what it
I
is.
bought some Reese cups the other day and I didn't need them. And it was like a pack like this long, right? So I opened one up. It was this long, each one.
Exactly.
And I just laughed.
Exactly.
I said,
So they're
well, okay.
charging more. They're giving you less of a product. And another thing, that these CEOs and everything are being paid 21, 50 billion million, and they can move on and the next one come in and make that amount. Do not tell me about inflation. Think about the head and what's coming from the top and how they are surviving and how they are actually doing this right in front of our face, and we are not taking up enough writing campaigns. We're not talking about it enough. We're not doing the things we need to do to fight against this. And it is unfortunate. So we end up in this lane of complaining. People begin to hear our vulnerabilities. Yeah, well, Biden ain't doing this and he not doing that, and we worse off. Huh.
Mhm.
1 million people died. You gonna tell me I'm worse off? I'm sorry. And Democrat, Republican, whatever you want to believe, I almost died during the pandemic. Don't talk to me.
Mhm. Mhm.
Okay?
So quickly we forget.
We
So
forget. I
so
passed out several times.
really.
Yes. I could have killed myself in those times I was passing out. I was sick for over 3 months.
Oh wow.
Yeah. And it was awful. And my friends were very worried about me. My husband was worried about me. I had
Wow.
lost so much weight. And so
Wow.
I tell people, please don't tell me about being better off. I'm alive.
Right. Right. Right.
Okay, I'm alive.
Right.
And I lost
Exactly.
5 family members during that time.
Wow. So let me ask you something. Since the pandemic, um, how do you think that it's affecting us as far as our children, how we
Mm.
communicate, how we take care of business? Because it just seems to me that the level of customer support has just gone downhill. And even when you go into the stores, I guess maybe I'm just old fashioned, but I don't want to ring up my own stuff. I want them to ring it up. So if there's a mistake, it's on them and not me. And I will stand in line to get that attention. And I read the other day that they're looking at this and they're rethinking it because a lot of money is being lost by probably stuff leaving out the store that wasn't rung up.
Oh,
Okay.
really? Okay.
And now they've given away these jobs of people. And I would tell them when I would be in the store sometimes, like, oh, well, when you come back, we're only gonna have one register. And I said, are you proud of that? Because I think somebody's getting ready to lose a job, but okay. But when you think in terms of what's going on as far as customer service, what's happening to our children, and even I'm looking at the colleges right now with the controversy that we have going on right now in the colleges and the universities, and they're really starting to look at the fact that a lot of the people that's making the havoc are not really the students of that school. See, so
Correct.
are we looking at something else that are we looking at something that we think is one way, but it may actually be something else going on? You know what I mean? And
Well,
how go ahead.
well, you put several
I know.
situations on the tables. Let me take your first one, which is the
Okay.
preschoolers, right? I mean, school children. Yes, our children have been impacted since the pandemic. When you think about preschoolers now, and me talking to teachers and interacting in some of the schools, what is discovered that during that time they wasn't really taught etiquette,
Mhm.
how to act, and so a lot of kids are coming into the school where they didn't get the preschool training, or they maybe not even gotten the kindergarten training,
Mm.
and they're coming into the schools and they don't know how to act, unfortunately. And a lot of teachers are dealing with that. A lot of teachers have left the profession because or retired because they don't want to deal, with these children, or they looking at other avenues of where they can come out of teaching, which is really sad, because we need
Yes.
teachers, right? So that is one situation that kids are dealing with, uh, because during the pandemic, neglect went up. Domestic violence went up, sexual abuse went up, all the abuses went up during the pandemic, and
Wow.
also impacted our children. So you think about it from that aspect as well. Language
Hmm.
went down. Uh, Kids are not. have lost some investment in learning.
Wow.
And so that has touched. And then you deal with anxiety as well as you're dealing with depression. A lot of anxiety and depression that our kids are feeling because they're scared. But at the same time, though, let me just say this: it's not that it has is wearing off. I can say in 2021, 2022, 2023, because I still see clients as a counselor. I had clients, no problem. I
Mm-hmm.
believe now that, not to say that people are getting better, but they are starting to adjust. So let me say that. At least that's what I'm discovering. So I said that's some research that I need to do.
Mm-hmm.
Where are we? Because as a people, we do begin to adjust to life the way it is, not really deal with the pain, the anxiety. We may self-medicate, which you said.
Mm-hmm.
uh, we may find other tools, a way of dealing with our stressors. Most of them are unhealthy. uh, Gaining weight, all kind of things can begin to happen, and so that's out there. And then I think you talked about, can you what was the other thing you said? It kind of slipped my mind.
Well, basically, I was just trying to see what is it that you, as a counselor, and you helping people, what is it that you're seeing the most of as far as what's affecting people? And I know, it's COVID, but I know that
Well, trauma is huge, right?
we're still
Trauma.
wreaking the habits of that as well.
Well, as I was saying, people are starting to adjust to life.
Mm-hmm.
So that's just true. People are adjusting to pain. We adjust to pain. So let me just say that people have traumatic experiences and they don't necessarily deal with them, and they can function. They go to work, they do everything, and but they are in a lot of pain. They are suffering. Still seeing people who are going through trauma, depression, anxiety, indecisiveness, self-esteem issues. Those things are huge. They're big, but I am also saying that people adjust. We adjust.
So what are some of your recommendations? So let's say someone that's just kind of feeling anxious and stressed out and um, you know, and yet they don't really want to be medicated if they don't have to be. Uh, what's your recommendation on that?
So when we deal with anxiety, and so let's just deal with anxiety for 1 second. Anxiety is really in the what ifs. What if this happens? So you're
Mm-hmm.
really fearful of what's going to happen when you're dealing with anxiety. And I know I have some other professionals on here, so if they want to tune in, they more than welcome. I love collaborating and hearing what other people have to say. And so a lot of times, therapists are afraid, or psychotherapists are afraid, or counselors are afraid to really deal with exposure. We
Mm-hmm.
tend to medicate, or like put Ativan and all these other type of anti-anxiety medications. However, I have received training under his name, and if anybody want to learn more about Dr. David Burns, Dr. David Burns is a psychiatrist, and a lot of my training in the last 3 years has been under Dr. Burns. That is one good thing. So I do want to talk about the good things that came out of the pandemic. Even though that I got sick, one of
Mm-hmm.
the great things that came out of it, I connected with Dr. Burns, and he does what he calls Team CBT. Team CBT is testing, empathy, agenda setting, or assessing resistance, and methods. And what
Hmm.
we do is that's the structure of cognitive behavioral therapy, which again, cognitive behavioral therapy is all about the truth setting you free. And as a Christian, I felt like that really aligned with who I am, because that's what Christ is all about. The truth shall set you free. So, in
Mm-hmm.
this training that I've been receiving under Dr. Burns, one of the things that we have come to grips with is that a lot of psychotherapists, counselor, therapists, social workers, we don't really engage in exposure. Uh, so there is a way for clients to get healed by exposing themselves to the things that they are afraid of. Now, sometimes that exposure may be cognitive flooding. You don't want to go out and do everything you say you're scared of. But let me give you an example. If you scared of flying, right?
Mm-hmm.
Um, so we're going to help you with that flying.
Mm-hmm.
We may set up a plan because some people who have anxiety, well, a lot of people who have anxiety, they are flying, but they are suffering greatly while they up in the air. So we'll set up a plan for them in dealing with that. And so that's important that we expose ourselves to the things that we say, that the what else we believe are going to happen, and in doing that, it allows us to take the teeth out of the monster, because you really are seeing this as a monster.
Mm-hmm.
And so once you can take the teeth out of the monster, it can't bite, it can't do what it's doing to you anymore. So
Hmm.
that has to do with exposure. Depression, let's look at depression for a second. Depression has to do with the things of the past. And you can really hear your negative thoughts. You can really hear you going off and thinking about all the awful things that are happening to you. And it can cause you to feel like you're alone, or you can deal with self esteem issues, hopelessness. You can deal with guilt. Um, not being enough, all of those things that you begin to deal with. One of the things that we subscribe for clients who are dealing with depression, which is the craziest thing to do, is homework. We give you homework to do.
Wow.
Yeah, we give you reading, things to do. And I've been in this profession for over 30 plus years. I've done a heck of a lot of talk therapy, let me just say that.
Mm-hmm.
And I am not opposed to talking, but as a person who has gone through a healing process, and who understands what it means to be healed from trauma, I have come to really embrace the fact that talking can't do it alone,
Mm.
that you have to get involved in your healing. And that means that like sexual abuse, that's
Mm-hmm.
anxiety.
Mm-hmm.
Anxiety, there's a lot of post-traumatic stress is
Mm-hmm.
anxiety. We don't
Mm-hmm.
talk about it from that perspective, but it is, because
Mm-hmm.
it's so much fear and a scaredness around that. And so what we need to do, what I have come to understand, is that therapy has to be interactive. You have to be able to give assignments, particularly when it comes to depression and anxiety. You have to be able to expose clients to what it is that they're afraid of, and we do that through worksheets, through podcasts. Uh, there and as and engage in making sure that they have assignments. It's a lot, and I love the therapy that I do now. I'm so much more effective as a therapist than I am now. And we do testing. That's a lot of things that we do. I detect in terms of the guessing game.
Mm-hmm.
You're guessing. Well, I believe they're depressed. No, I take that out. I don't
You
have to
test
guess
for it.
anymore. We test for it, and it's
That's
a brief
excellent.
mood survey that we do, and it has 6 areas that we test on. 5 questions except suicide. Suicide has 3 questions, and I'm talking more for the adults. And so
Mm-hmm.
we test on depression, anxiety, suicide, anger, happiness, and relationship. Those are the six areas, and they have to complete it before we have a session and after the session. And that way I get a good reading on where they're feeling stuck at, where they're growing, what type of things they still feeling impacted by. And we begin to look at that. And as a therapist, we look at one moment in time. a lot of times when I was doing therapy, the way that I thought was the more appropriate way to do, I was looking at things from the standpoint of talking with them, and then they throwing all these things out at me like
Mm-hmm.
a salad, okay? Just woo.
Mm-hmm.
And I'm supposed to try to get through all of that. Well, Dr. Burns, what he has done, he has allowed us to say, okay, think of that one moment in time. Because what we have come to understand is that we are all creatures of habit.
Yeah.
So because we are creatures of habit, whatever it is that's disturbing, once you think of that one moment in time, and you have to think about it from person, place, or time. Once you begin to think about it from those aspects, person, place, or time, an upsetting event that has happened in this person's life, we understand that it is going to generate into other upsetting events because we are creatures of habits.
Wow.
Yeah.
I have someone in the chat that said that they have a fear of elevators.
Yeah. Okay.
You want to, I believe that's from Jan. Jan, do you want to elaborate on that a little bit?
Yes, I do. And I guess and same thing with MRI machines.
Oh,
I used to get on elevators, but then when I got stuck on one, I was at
mm-hmm.
Mm.
college in the library and I got on that elevator and with some other friends of mine, and it stopped between floors and I freaked out.
Yes.
Mm,
And now if there's stairs, I don't care if it's 24 flights of stairs, I would take it.
Yeah. Yeah,
And the same,
Jen.
yeah, and the same goes with the MRI machine. That's when I felt when I found out I was claustrophobic because my doctor had to prescribe me Valium because I couldn't take it. I just
Mm.
could not take it. And my sister-in-law went with me one morning. As long as I felt her touching my legs, I was fine. I get the spirit that something's going to happen.
Yeah. Yeah.
Mm-hmm.
Yeah, that you're right, Jan. And I can imagine that that was scary being stuck in that elevator like that and not knowing how you're going to get out. I can imagine that that caused a lot of anxiety and uncertainty in your life. And I can also imagine that you vowed probably that that was it. And you didn't care how many stairs you had to walk up. Like you said, you were going up those stairs.
I'm going up those stairs.
Yes, yes. And so, that makes sense, right? That
Uh-huh.
makes sense, a lot of sense. And so one of the things that we will begin to deal with is those cognitive distortions. And so one of the and one of the methods that possibly can be used is when we begin to examine the evidence because you're right. You were stuck in that elevator. So, not trying to do therapy at this time, but we would examine and explore how many times that you wasn't before that situation happened,
Mm-hmm.
right?
Right.
And what those elevators meant to you at that time, and what that one incident, it was traumatic. It's clear it's traumatic, right? Because you're like, you'll never give me elevator again. Yeah.
The only way I would take it is when I see someone get it on there and it was like with my sister. She had to go for a procedure. And the only way to get to the doctor's office was on
mm,
the fourth floor. I'm like, okay, she's with me. There's some other people. I was just thinking in my head.
mm-hmm.
And I know that's crazy. I look at the elevator, I look at the doors. If it's a vent or something there, I won't get on. So it just, I mean,
Yes,
like I'm analyzing
yes.
everything. And so once we get on
Hmm.
there, I close my eyes and
Yes.
the elevator was quick. So that made it even a little bit easier for me. I can't stand it when I get on there and it takes, to me, it seemed like it's forever for the doors to open.
Yeah.
That
Mm-hmm.
particular one, it opened up, it got to where it needs to go and it opened up real quick. I can't. I mean, that's just it. So it's the same
Yeah.
thing with MRIs. That I know they have the open MRIs, but my doctor, like at that time, he likes the closed MRIs because he feels like that's a better image than the open ones, which I never had. But that's just something, and that stuck with me. And really, that elevator at the college, at the university, we went in there no more than about, say, maybe 10 seconds, and my friends were laughing at me because I was just freaking out. I'm like, well, hey, I said I didn't like it. I didn't like the feeling, and I think I was
Yeah.
hyperventilating. Yeah, so now it's just, I know I got to try to get out of it, but if there's some stairs, I'm gonna take it. That's what I did
Right.
Monday.
Yeah.
Yeah.
So
Yeah.
I got
And
a question. I got a question now because she said a few things here.
hmm
And just so you know, Jan, they do have MRI machines now that are open where your feet are hanging out.
yeah, that's
And
what she was saying.
yeah, yeah. And so they're a little better than what they used to be. I don't know how long ago that was, but it doesn't matter. She's
Hmm.
going back. And a lot of times when you think in terms of people that have uh, I say fear sometimes is false evidence appearing real, but it's real to them.
It's
And they're
real.
right. And so what would be a suggestion to someone that is even say having a panic attack where all of a sudden they just feel like their heart is about to jump out their chest, right? For whatever triggered them. What is a quick technique that they could use for something like that?
So I don't do quick therapy, but let me
Okay.
do share with you, Dr. B. Like, for instance, this is a good example.
Okay.
So if a person believes that they about to have a heart attack, right?
Uh,
And they're fearing and their heart is racing fast and they believe that they're about to have that heart attack, start jumping up and down. Start jumping up and down. See how
hmm,
you're gonna have that heart attack. See, are you gonna have that heart attack? Start jumping up and down.
hmm,
And I say that based on that you are fearful. This is
right.
something that comes in your mind on a regular basis that you're about to have a heart attack. Every time you have a panic attack, you think that you're going to have a heart attack. Start jumping up and down.
What's
Start
that?
doing all type of stuff, turning and flipping around. Do it. As a matter of fact, elevate it up a little more. Believe that you're going to have a heart attack. It's anxiety. We're dealing
Mhm.
with anxiety. Believe it. Start jumping up and down. Okay, quote unquote, because don't be going away from here talking about, well, Dr. Hall said that
No,
I
no, no,
can
I
don't,
get
and
it.
no, see, that's why I say I don't be doing no quick therapy because
No,
people need to come in, they need to be assessed,
right,
and be spoken to. But that's just one thing that from just reading books
right.
and one of the techniques that Dr. Byrne has used, and I have even utilized that, encouraging my clients to start jumping up and down because they
Hmm.
said because that's how they start feeling. And then uh once they start doing it, they're like, well, I guess I wasn't about to have a heart attack.
Mm-hmm.
And I had a gentleman who came to see me, and he knew to deal with his anxiety that way. He said whenever I felt like I was going to have a heart attack, I just would start exercising
Hmm.
and doing things, and I didn't have it. He said I didn't have it, and that's the way he began to deal with it.
Wow.
Another thing may be, I love this story. If you are afraid of ladders, if you're afraid of heights, go up on the ladder. Do not let the ladder fall. Okay, we're not trying to fall off no ladders. But again, quote unquote, I would need to see you in
Right,
therapy. This is a
right.
story though that I'm saying. And you're afraid of heights. Go up on the ladder and go up higher and see what's going to happen. Because what you are imagining what's going to happen isn't going to happen.
Exactly. False evidence appearing real most of the time. What about
Yeah.
breathing techniques? Because I've heard people say that breathe, do some breathing and hold your breath for a minute and all that kind of stuff. What do you think about that?
I don't have a problem or issue with people utilizing breathing techniques. I call myself Exhale with Regina, okay? And
Oh,
so
okay.
I do believe that you can begin to open up your blood supply and breathe, and I believe that is a technique that you can
Mm-hmm.
utilize. It's not one that I necessarily I encourage clients to breathe. However, I also encourage clients to do more exposure.
So exposure meaning Meet
And
your fears.
meet your fears. That's right. Meet your fears. That's right.
Wow.
And you don't have to take it on like like is you can take it on in a step at a time. Working with a
Gradually.
therapist, yeah. Some people
Right.
have performance anxiety, right?
Right.
And so people are afraid to speak,
Right.
right? So people have many fears. You can't overcome those things by doing what you're afraid of doing, what you believe is going to happen. Some
Absolutely.
people, I mean, I had someone who actually froze up speaking, and that was really difficult for them. But they could have stopped speaking, but they kept on speaking, and they
Mm-hmm.
only experienced that one time,
Mm-hmm.
right? It doesn't have to define your life. You don't have to allow things that happen to us to define us.
Right.
You
Wow.
can tackle it. You can. It's
So,
not easy, but
right.
what you want to do is reduce the pain. But let me say something about that. There
Okay.
are some great and awesome things about that individual in those negative things.
Mm-hmm.
Like Jan said, that she's cautious. So Jan told me some things about herself. She
Mm-hmm.
told me that she was cautious. She
Mm-hmm.
told me that she's willing to try a different avenue than the
Mm-hmm.
one that she had been trying. So she's open to going in a different direction.
Yes.
So Jan told me some things about herself that are
Absolutely.
beautiful and awesome. I think a lot of times we deal with just the negatives, but we don't think about, anxiety. It protects us too. It can. People, because you believe that whatever it is you thinking is
Mm-hmm.
protecting you from.
Mm-hmm.
So Jan is not going on that elevator because she really believes it's protecting her from ever experiencing that and possibly ending up in a worse type of a situation.
Mm-hmm.
And so she's protecting herself.
Right. It's a
So when
form
you
of
think
protection.
about it, there on the other side of that, there's a negative and a positive to everything. So you think
Exactly.
about the other side of that, think about the positives of that. It also point to some core values. You
Yes.
know, you have to think about that. Even when you think about depression, right? You
Mm-hmm.
you think about depression or somebody being depressed, then think about the opposite, the positive things about that they're realists. Okay, about they know that they have flaws, right? They have an understanding of their limitations.
Mm-hmm.
And so when you begin to think about it from that way, there's positive and negatives in everything. And so, one of the things that we do in the type of therapy that I work on with clients is that we begin to look at reframing. We call it positive reframing. We look at those positive, awesome, wonderful things about you. Uh, because there's some great things about you in this. And so we
Wow.
discover that together.
That's great. So let me ask you, so if someone wanted to use your services, do you accept Blue Cross or what type of, what form of insurance do you accept, or is it pay as you go, or how does that work?
So, two ways. So, private pay is what I do on my own.
Okay.
Okay. I through my company, I work with a couple of organizations
Mm-hmm.
that handle the administrative. They make sure I get my credentialing, done, the
Mm-hmm.
insurance and all that. I did not want to deal with that, but I also didn't want to work for nobody else.
Mm-hmm. Mm-hmm.
Okay. And so I provide services um and um and they help me with my marketing and they help me because I do a lot of remote. Okay.
Mm-hmm. Okay.
It
That's
oh
good.
yeah, mine's is mostly remote when I'm seeing clients. When I go out and speak and train, I'm going more into the organizations or companies.
Mm-hmm.
Um, but when I'm just doing my counseling, I feel like 30 plus years I've gotten to the point where I don't want to go in the office anymore. That's where
Exactly.
I've gotten.
I
Yeah.
understand
Now
that.
this is where I am. Now that may change, but I'm saying this is where I am today.
Wow.
I so private pay
Okay.
if clients want the services. If they want to go through one of the organizations who handle my administrative side, they can
Mm-hmm.
go through them. utilize their service, utilize their insurance, and
Okay.
still be seen by me. So that's the
Oh,
way I have done it.
excellent. All right. Wow. This is fantastic. So I want to kind of open it up to the audience right now. Does anyone have any questions? This is your opportunity to ask Dr. Regina Hall. Any comments, questions, fears, anything you want to discuss quickly?
Well, I know we have a couple of social workers, we have teachers.
Yes.
I would like to get some of their input on what they believe are going on with the students. It's nice to hear what they think about critical thinking and what are some tools that they have utilized to help or think would be good suggestion for others. Like I said, I mean, I believe in collaboration.
Oh, absolutely. Any comments from anyone? Come on, you guys, don't be shy. Don't make me call on someone. Okay. Miss Christine, I'm gonna call on you. She's gonna like, oh, Dr. B, why are you doing?
Hello. Can you
Hi.
hear me?
Yes, Christine is awesome, and I know she's doing some work
Hi,
at the University of
Christine.
Michigan. And
Hi.
Christine, tell us what's on your mind.
I don't know. I work in child welfare. So I think what I see is a lot of like intergenerational trauma
Yes,
that
for
gets passed down
sure.
from the parents to the children.
Mhm.
And I do think COVID has had an effect on the parents and the children, but not as much now. But yeah, it's more the intergenerational trauma that I see a lot of and trying to break those cycles.
That is so true, Christine. I remember when I was working, I was doing the reunification programs. And I think they have gotten rid of those. I think somebody was telling me they were kind of bringing them back a little, but this is when it was huge,
Hmm.
years ago. And it was generational trauma and even being in the system. And so I would be in the court uh, working with a family to reunify them, and the judge would say, I was hoping that you would pick a different route from your mother. Now I have
Mm.
3 generations up in here. I done seen your mama, now you, now your daughter. 3 generations. And I was like, are you kidding me? What's happening here? But that was true. So in the child welfare system, unfortunately, you do see a generation of it going on from generation to generation. Yeah.
Yeah.
Yeah. Well, God bless your heart.
Oh, thank you.
All right, we have a young lady, Miss Kamara. You have your hand up.
Yes, hi, good evening.
Good evening.
First, I want to say this is an amazing podcast. I'm actually here doing my walk for the evening while I listen, and I can say it motivated me because as you all were speaking, one of the scriptures came to my mind was Romans 12:2, as we talk about renewing our mind.
Yes.
And as we renew our mind, because we're faced with so many different challenges, and as I listened to you, I one of the things I was thinking about is being able to identify the core of our problems, the core of
Yes.
our situations. So my question to you is, as we're trying to better ourselves and identifying those fears or those things that's preventing us from being our better selves, what is your recommendation as we take our first step to doing so?
You know, that's really a good question, right? And I love the fact that you identified that you're a woman of faith. So one of the first steps is one for me is really recognizing where you are in your relationship with God. If you're a woman of faith or you're driven by your faith, I encourage faith within my therapy because I'm also a Christian counselor. I'm not, I do cognitive behavioral therapy, but I'm also a Christian counselor. And one of the ways when I went through my healing process, Kamar, I went through my healing process by really combing through those scriptures. And it was, and I saw a counselor when I started going through my healing process. So I would tell people it just depends on where you are in your walk. If you believe that it's something that you can get comb through scriptures get into a Bible study, begin to learn about the mind. I was reading books, I was listening to podcasts, I was doing everything. I was going to a counselor, but sometimes we need guidance and we need to see a counselor and we need to see a
Mhm.
professional counselor. A lot of times we go to our pastors or we go to some of the ministers in the church and not, hey, I'm a reverend, so let me just say that, but they're not trained. Sometimes we need trained people to
Mhm.
walk us through. And prayer is awesome. As a matter of fact, it is a weapon that we can use. It is a weapon that we can use. But we also need to learn scripture. The Bible tells us to pull down the strongholds of our mind, cast out all imagination and anything that exalts itself against the knowledge of God. So, what's in your life exalting itself against the knowledge of God? That's a scripture. Okay, Romans 12 too. You're right. It talks about the renewing of our minds. Yeah, but how do we go about renewing our minds? What is it that we need to do? We need to wash our minds in the Word of God. Oftentimes, we're not spending enough time learning scriptures and learning about God. If people do not know the Word of God, get in touch with what your thoughts are saying to you. A lot of times, we are not listening to what we're saying in our minds. We're just walking around thinking thoughts. One of the things that I do an exercise with my clients, and I get them to write down their thoughts. And then I want them to look at those thoughts, and then you can go on my website. It's reginachall.com, and you can download. It's called the 15 Styles of Distorted Thinking. You can download that. It's right on my website, reginachall.com, and I get them to begin to identify the distortions that are in those thoughts. You can do that yourself. So listen to what you're saying. We see a lot of things that we're not in tune to. Once we start getting in touch with our thoughts, write them down, and then think about the distortions that are in them. All or nothing thinking. This is a big one. Black and white. We see things in black and white. Well, you know what? I'm not going to deal with her anymore because, the way she talked to me, I don't have to deal. That's so black and white. Maybe she had a bad day.
Right.
Maybe she talked the way she did to you because she had a bad day. So we call that all or nothing thinking. You're seeing things in
Mhm.
black and white. Overgeneralization. Overgeneralization is this always happen. Nothing always happen in our lives. It does not always happen in our lives, but many of us are convinced that things always happen. Mental filtering. Mental filtering. We filter out all the good and only look at the negative,
Mhm.
discounting the positive. Think about it, women. Somebody walk up to us and tell us what a beautiful dress we got on, and we say, or a beautiful outfit. We say, oh, this whole thing. We just
Mhm.
discounted it. So anyway, what I just shared with you, that's on my website. Get in touch with our thoughts and begin to look at the distortions of your thoughts.
Wow. Did that answer you, Kamara?
It absolutely did. Thank you so much for that insight.
You're
And just so you
welcome, and
know,
thank you for
Kamara she's a military active, and so we got to thank her for her service.
oh,
And
thank you, Kamar, for your service. Thank
I
you.
definitely appreciate it. Thank you.
okay,
Yeah.
thank you, Kamara. All right, Tim Nelson, you have his hand raised.
Hi, Tim.
Hey, how's it going? All right,
Good.
so I gathered from when you mentioned depression, you had mentioned it being on past events, which um, my thoughts on that were that you were speaking upon situational depression. So, what is your interpretation of the difference between situational depression and like if somebody has a chemical imbalance as is dealing with bipolar disorder?
Yeah, so bipolar is different, right? Bipolar is dealing with manic, right? As well as mania, right? And so my take is that there are some similarities to it. But when you think about bipolar, you're talking about a person that having some severe mood swings. And so most of the times what I do with that, I do an assessment on that to really make sure that the person is dealing with bipolar. And some people are not necessarily having to be medicated. But what I have found is that clients that are dealing with the manic and the high mood swings, they may have to get medicated for a time until they get some things under control, but some of them can be without medication, but that takes testing and assessing, and I'm not quick uh, to give any to give the big huge advice about, or to really talk about it in a sense without the person being tested and being assessed for that and what's needed. And I may even refer them to a psychiatrist to even get further testing. So
Thank
that's
you.
the way I tend to handle that. But you're
Thank
right.
you.
It's because you got chronic depression, right? People have been in depression, Tim, and it's not bipolar. It hasn't been appropriately dealt with, and they've been depressed for 20 something years in dealing with it, off and on, recurrent major depression that they may have been dealing with. Um, and those are things that we can begin to work through and not necessarily uh, have to be medicated. So, but I do believe that you have to deal with each individual.
Mm-hmm.
But I am glad that you brought up the situational, because I would say that mine was chronic. It happened when I was a young girl, and I really didn't heal until I was like in my late 20s from it. So I had walked around a lot with anxiety and depression from what had happened to me because nobody had dealt with it with me, unfortunately.
Wow. Well, tell us about your book.
So my book is called Mommy, I Need You. And the purpose of my book was to share my story once again of the sexual abuse I suffered at the hands of a next door neighbor, and the power of God, how God healed me and, healed my mind and really brought me and my mom closer together before she left this earth. Me walking in forgiveness and not really, and my dad, because, even though I really believe my mom was the first one that could have done something about it, and she didn't believe it. And let me tell you, when I told her, she asked me a question, and I told her it was the perpetrator, it was Abbott, because I had something on my dress, and so she was like, "What is down on your dress?" And I told her Abbott. Well, she didn't believe it. And then my dad didn't believe it when he found out. So not really having that support of my family believing me. And that's one of the things that really helped me to even write my book, Dr. B, is
Mm,
because there are many young women that wasn't believed, or mothers have partners in the home or people in the home who are
mm-hmm.
doing things and they're brushing it off. Um,
Mm-hmm.
and unfortunately, he used my best friend as as his uh as his decor to get me, because she invited me to play. So who knew that he would utilize my best friend to
Mm-hmm.
do that, because we were playing in her big mom home when it started, and not believing me unfortunately kept it going. um and so it was really a big thing to heal through. And I talk about my anger with God, how I didn't really understand why God allowed it to happen. That's a question that when we have traumatic events to happen in our lives, that's something that we ask. We say, "Why, God? Why? Why did you allow this to happen? You supposed to be God. You have the ability to stop it." And I did confront God with those things, and the Lord gave me a simple answer: we live in a decrepit world,
Mm,
and people do harmful and hurtful things. That was powerful for me to hear, because that's really true. We live in a fallen world. As a Christian, I believe that this world is falling. You test it out. You'll believe it too if you test it out enough. It's falling. and,
word.
and and so when God gave me that answer, it brought healing to me. That, wow, this is a fallen and decrepit world, and people do hurtful things. And then I was listening to Joyce Meyer, and Joyce Meyer said, hurting people hurt people.
Hmm.
Hurting people can hurt people.
Mm-hmm.
And so, you know, and the biggest thing that brought healing, and when the Lord let me see that anybody that accepts Jesus Christ as their Lord and Savior is welcome into the kingdom. They could be killers, they could be rapists, they could be child molesters, they could be whatever. If they accept Jesus as their Lord and Savior and want to turn their lives around, they are accepted into the kingdom. I boo-hooed when God told me that. That's in my book. Those
Oh.
are real issues because we say these people need to die. They creeps, they this, they that. And what? They are all of that to us. But God said that they're his people. He made them and he died for everybody. That's deep. So I talk about these things in my Bible that I struggled through and I had to get through, and how God had to lead me into forgiveness, my mom, my dad, and the perpetrator. And so it's a lot that I had to deal with and get through. But I wrote my book for others can get through it and deal with it as well.
Wow. So do you have a number you'd like to give out? So if someone wants to get in touch with you for
Sure.
future counseling or to use your services, what is your number? I'm going to put it in our chat. And I also
Yep.
have added reginachall.com, which is
Yes.
her website. I invite you
Yes.
all to go to her website and use her testing. And this is all free stuff just for being on
Yep.
Dr. B Stress Free Real Talk for You. And Mommy, I Need You sounds like a very, very good book to read. And I know even with Christine, I know you're dealing with families and children and that. So that might be something that you want to use as well. And does anyone have any other final comments or questions? Because we're only on an hour and it
Okay.
has been an
There
hour.
go the note right there. And they can text me or they can call me. I would say text me at that number because I tend to get the text more faster than I do the
Okay.
calls. But that is the number that you can call me at. That's my office number, 248-648-1733. My website is reginachall.com. You can go on my website and download the 15 styles of distorted thinking. And again, thank you so much, Dr. B, for having me on your show. I appreciate it.
Wow. Well, I give you a thumbs up on this. This has been awesome. Again, another
Thank
awesome
you.
episode of Dr. B Stress Free. And again, mental health is real and it's okay to not be
Yes,
okay, right?
yes,
And
yes.
therapists need therapists, right?
Amen. Yes, therapists need therapists. Physician, heal thyself.
Right. So I want to thank you so much, Regina, Dr. Regina. I know you're going to probably get some calls from a few people that would love to get with you. Again, like I said, we all need help out here. So, and May is Mental Health Month, right?
Yes, May is Mental Health Month. Yes. So thank you for kicking it off at the end of April. How about that?
Okay, well, thank you, everybody. I really, really appreciate you guys for jumping on because without you, it just wouldn't make our collaboration, communication, and keep everybody here where they can get their information. So thank you guys for jumping on, and we'll see you next Tuesday. Have a blessed day. Thank you,
Take
Dr.
care.
Regina C. Hall.
Yes,
Don't forget,
thank you.
go to her website. Have a blessed
Yes,
evening.
you too.
Bye.
Bye-bye. You didn't need me to stay on, did you, Dr. B?
No, you're good. Thank
Okay.
you.
All right.
Bye-bye.
Bye-bye.